new legislation giving regulators more teeth, if you will, and additional boots on the ground in terms of revenue to hire more auditors to enforce both the overbilling of Medicare and Medicaid and specifically with regards to data privacy breaches. The government, and we'll talk a little bit further into the presentation about how the government has indicated they're going to take all of the fines and penalties monies that they secured during 2013 for data breaches and plow that right back into the budget for hiring more auditors to prosecute more reviews of data breaches in 2014. So limited access to capital is just another economic reality that is making it difficult for organizations to offset a lot of these other things causing financial pressures on the bottom line. So we've talked about healthcare antitrust claims being on the rise. Fraud and abuse recoveries, significant money the government is recouping for overbilling Medicare and Medicaid. The Federal Trade Commission is trying to get into the act and have a little bit of jurisdiction in the healthcare space on a variety of fronts. Most recently in the cyber data breach area, they're trying to find that, or trying to see if certain courts in certain states will agree that a data breach is de facto a violation of a Fair Credit Practice Act, which gives them jurisdiction then to jump into the game and assess some fines. We've yet to see whether that trend is actually going to take hold, but obviously that's very disturbing, as we certainly in the healthcare space don't need another government agency with enforcement capabilities against organizations for data breaches. The increased merger and acquisition activity that we've seen is certainly, again, part of health reform in a variety of areas necessarily results in organizations acquiring other organizations for financial reasons, for efficiency reasons, to marry together and be able to provide services together that individual organizations couldn't do separately. All of this falls under the umbrella of delivering, as healthcare reform wants, more efficient delivery of care in a better type of delivery model. But by the same token, it increases the ability of the government to say that maybe you've affiliated too much in your particular market area. That's creating some anti-competitive situations that need to be unwound. Okay, so if we're moving on now from the D&O liability trends, these are some unique exposures and key coverage features just to keep as a handy point of reference in terms of what the exposures are in the space and what the coverages are that are available to deal with these exposures. Okay?